Hello, my name is Kevin Nicholson. I'm the Director of Therapy Services at Vibra Rehabilitation Hospital in Amarillo, Texas. Today I would like to talk to you about lower extremity amputations and what we can do in the rehabilitation setting for those who have had an amputation. The need for rehabilitation following lower extremity amputation is likely to grow, and the statistics surrounding amputations paint a very clear picture as to why. Currently, there are about 2 million, just a little over 2 million people in the United States who are living with limb loss. That number is expected to grow, actually to double, over the next 30 to 35 years to around 4 million people. Every year, about 185,000 people in the United States have to undergo an amputation. 85% of lower extremity amputations are preceded by a foot ulcer. In other words, a wound on the foot starts a cascade of events that ultimately leads to an amputation. We see that, of course, many times with the diabetics, the people who have diabetes. The number of amputations caused by diabetes increased by about 25% from 1988 through 2009. That number is probably going to continue to increase as well. Now, these statistics are frightening, especially for those who suffer with diabetes. However, if you or a loved one does have to or are faced with having an amputation, your physician may advise that you begin your rehabilitation or your recovery in a rehabilitation hospital. And we here at Vibra are very well prepared to help you with your recovery. In our rehabilitation hospital, you get daily medical attention that is intended to ensure that your body is optimally tuned to heal from the amputation and to begin the recovery process from the surgery itself. Things such as medication management, pain control, healing of the wound or the incision from the amputation, those are early priorities for anyone who is a survivor of amputation. At the same time, our team of physical therapy and occupational therapy professionals will work with you to establish goals for your recovery. At its core, or at the base of your rehabilitation, we will probably focus on two overarching goals. The first of those is to help you regain function. This includes the ability to manage your own daily self-care without the benefit of both of your lower extremities. This can be very difficult, and we have techniques and interventions that we can use to help you become successful at that. The second thing is to prepare your body and the amputated, or including the amputated lower limb, for use of a prosthesis, or as it's sometimes called, an artificial leg. That's the ultimate goal, is for you to be ready to use a prosthesis. With few exceptions, there are a few exceptions when people will not be able to use the prosthesis, but overall our goal is to get you to that point where you're ready for a prosthesis. We're able to obtain and document objective information in our facility that can go with you when you leave, and are consulting with a prosthetist or someone who makes the prosthetic limbs. We can give that information for you to take, and that will help them to make the decision on an individual prosthetic limb for you. We're willing to make that information available to anyone as well, with your permission. We think this level of communication is very important, not only within the facility but outside the facility. When you do begin the process of getting your prosthetic limb, that communication is very important to ensure that you get a prosthetic limb that is suited to your individual case and help you transition to a productive life following your amputation. Thank you for tuning in today.